Hypertension, also known as high blood pressure, is one of the most common medical problems in the modern world. The World Health Organization estimates that 1.28 billion people in the world between the ages of 30 and 79 have hypertension. Nearly half of this number are unaware that they have high blood pressure. It is a major contributor to premature death worldwide. So why is high blood pressure so bad? The condition can cause heart attacks, strokes, and heart failure, among other medical issues. It typically develops gradually. Unhealthy lifestyle choices, such as failing to get enough regular exercise, can be a factor. One's chance of developing high blood pressure may be increased by obesity and certain medical conditions, like diabetes. High blood pressure can also result from pregnancy. It can damage your arteries by making them less elastic, which decreases the flow of blood and oxygen to your heart and raises your risk of heart disease. But do you know the signs of high blood pressure? Hang around to find out about the top 5 signs of high blood pressure. Number 1. Shortness of breath. The first sign of high blood pressure will often be difficulty breathing while performing everyday tasks. These might include carrying groceries or climbing stairs. When you exercise, you might also experience breathing difficulties. As hypertension progresses, you may well feel shortness of breath even when you're not moving around. Number 2. Chest pain.
Given that hypertension is a major contributor to heart attacks and heart failure, chest pain, or angina, can undoubtedly be a sign of hypertension.
Extremely high blood pressure can impair the blood flow to your coronary arteries, which increases your risk of having a heart attack or myocardial infarction. You may experience chest pain if this happens. Number 3. Blurred vision. Hypertension can also manifest as blurry vision or changes in vision. Your retinas are located at the back of your eyes and are filled with many tiny blood arteries. These vessels may become compromised or damaged if your blood pressure is extremely high, especially if it is persistent, and you may develop a condition known as hypertensive retinopathy. Even the smallest blood vessels at the back of your eyes have the potential to bleed, which can cause visual impairment. Additionally, you may actually lose vision if the blood supply to the retina is hampered or even stops. Number 4. Headaches. A headache or ringing in the ears could be signs of hypertension. The arteries in your brain may experience increased pressure if you have hypertension, especially if it is very high. Number 5. Blood spots in the eye. People with diabetes or high blood pressure are more likely to experience blood spots in their eyes. Damage to the optic nerve brought on by untreated high blood pressure might be detectable by an ophthalmologist. It is important to recognize that the symptoms we've described may have causes other than hypertension. That's why it makes sense to have your blood pressure regularly checked by your healthcare practitioner. It also makes sense to regularly check your blood pressure at home. Links to several good quality blood pressure monitors can be found in the description of this video. Thanks for watching and subscribe to get more health and wellness insights from WellWize.